Hello and welcome to my presentation on the case for the use of hallucinogenics, psychedelics, and naturopathic medicines for the treatment of mental health illnesses and conditions. To begin, I will start by explaining some of the benefits and some of the uses for such types of treatments. The first one that we will speak about is ayahuasca. Ayahuasca is a psychoactive Amazonian brew that has been shown to be effective for the treatment of depression and anxiety. An open label clinical study found significant therapeutic benefits among patients with treatment resistant depression symptoms, such as major depressive disorder. After the administration of just a single dose of ayahuasca. The next substance that we will speak about is psilocybin, or also known as magic mushrooms. Psilocybin has been proven to be effective in the treatment of depression, anxiety, cluster headaches, post traumatic stress disorder, addictions, and Alzheimer's disease, to name a few. There are multiple clinical trials that support psilocybin's ability to reduce stress symptoms, to reduce depression symptom severity, to include people with treatment resistant depression. Psilocybin's effects are much more immediately observable in comparison to antidepressants, which could take 3 weeks or more. Psilocybin the effects are often seen within 1 to 3 days of administration. The third substance that I would like to speak about is ketamine. Ketamine is used for the treatment of treatment-resistant depression, suicidal ideation, post-traumatic stress disorder, and substance use disorders and addictions. Similar to psilocybin, one of the biggest advantages of the use of this substance is its rapid onset of action. Many patients report feeling better within hours of receiving treatment, which is significantly faster than the weeks or months it can take for antidepressants to take effect. The fourth that I would like to speak about, the fourth substance that I would like to speak about is ashwagandha. Ashwagandha is also known as Indian ginseng. Ashwagandha has been used traditionally in Indian culture for thousands of years. Studies show that it is highly effective in the treatment of a variety of mental health conditions, to include stress, anxiety, depression, and bipolar disorder. It has been traditionally used as an adaptogen, which is believed to help the body resist physical and mental stress. The final substance that I would like to speak about is cannabis. Cannabis has been shown to be effective in the treatment of epilepsy, chronic pain, cancer, multiple sclerosis, post-traumatic stress disorder, fibromyalgia, and Parkinson's disease, to name a few. Studies have shown that people with post-traumatic stress disorder have a greater availability of cannabinoid type 1 receptors, and as a result, cannabis use by individuals with post-traumatic stress disorder can produce short-term reductions in PTSD symptoms. Users also reported even greater improvements in PTSD symptoms when observed over the course of a year's time. There are many reasons why people would prefer a naturopathic, psychedelic, or alternative therapy instead of traditional Western medicine. A few of those would be that they have a higher safety and tolerability. They work much faster. Um, they are less concerned about unwanted side effects that many prescription medications can cause. Also, many people feel that natural, holistic, um, psychedelic type therapies are a safer, a healthier alternative. Many also appreciate the fact that these substances can be individualized or personalized to the individual. In the 1970s, the federal government classified psychedelics and hallucinogens as Schedule I substances, which made them illegal to possess even for research purposes. This led to the research up until this time being very limited. However, decades later, these substances have been used for the treatment of disorders like post-traumatic stress disorder, depression, anxiety, and addiction. The present upsurge in research is partly due to the changing attitudes among government regulators and also the public. As a matter of fact, in 2019, the FDA approved the use of a form of ketamine to treat depression and is also considering approval of the psychedelic drugs psilocybin and MDMA for the treatment of post-traumatic stress disorder and depression. I personally believe that physicians and practitioners should begin offering natural or psychedelic treatments alongside traditional medicines, which would give patients the opportunity to choose which path is right for them for themselves. My hope is that in the future, the research and implementation and use of these types of treatments will become much more common and widely accepted than they have been in the past. I believe that this would greatly increase the chances of success in regards to the improvement of mental health conditions and illnesses. Thank you.